Today we're joined by Rony Arafin, Director of Health Insights at the British Heart Foundation. Rony's passion for healthcare is driven by his belief that data really can help save lives.
As long as you can connect with your purpose, I think you will connect more with what you can deliver with the data you're working with.
In our conversation, Rony emphasises the importance of mentorship and diversity, stressing the need for more allies and role models to inspire underrepresented groups to enter the field.
So lots of people who are maybe on senior roles wanting to be a director role, or junior analysts wanting to be a data scientist, we're pairing people up with people who have done it already so they can give real life advice on how they could take their career in the way they want.
Rony shares the challenges of siloed health data and the goal of creating a holistic view on patient health.
You do need to understand multiple conditions of someone goes through, so it's not just one area. So for example, you may have cardiovascular disease, but you may also have an underlying mental health issue that you've been suffering from a long time. So the type of delivery of the health service needs to be provided to that person in a personal way.
This episode is a must listen for anyone in healthcare analytics, passionate about diversity or interested in how data is transforming patient care. Rony's energy and insights truly shine through. Enjoy! Rony, let's talk data.
Thank you, Emma.
So you are Director of Analytics currently at British Heart Foundation.
I am.
And before that you spent considerable amount of time in the NHS.
Yeah.
And as we all know, data and analytics plays a huge part in healthcare. But can you just let us know really the deep work that goes on to achieve mission and advancements within healthcare?
Yeah, first of all, thank you for having me.
You're so welcome.
Delighted to be here. So I lead the analytics team in the British Heart Foundation. And previous to that, I worked about 15 years in various different organizations in the NHS. So the data, as you know, plays a huge part in all the things that we do. Actually try to save lives of people's lives. Data plays a big part because the advancements of AI and machine learning and technology is moving on. And before, I think, probably pre-pandemic, people just didn't really realize the potential of what data could do. But through the pandemic, you've seen more and more about how general people have seen how figures are getting reported and how they can relate to some data. Now, I think that's became part of the backbone of the health system as a whole, that if we really need some transformation, how do you achieve that? Because, you have consistent workforce problem, you have lots of other issues they exist. So the way to tackle it really is to utilize the information and insight people have.
Yeah, of course. I love how you refer to it as the backbone, and that's what it should be. And when you first started your data journey within healthcare, was it more like a side thing, a side function? Yeah.
Yeah, no, most definitely. I think it was really difficult. So about 16 years ago, when I started my journey in the health sector as an analyst, really, so I started my career as a senior analyst. So it was really hard because you didn't know how you want to progress, how you utilize data. And NHS is a big organization as a whole. The health system has got tremendous amount of data, but really difficult sometimes to know how to make use of that.
Yes.
So as an individual, when you're coming into the profession, you don't really have much help to how you can utilize your talent as an individual. So yeah, it was quite difficult.
Sure.
And as you said, I think part of the problem was that data sometimes gets buried under digital as a whole.
Yeah.
And that didn't help at times, because there are lots of really important works going on in IT in general, but data as an own entity, sometimes people didn't recognize how much value it can add.
Yeah, absolutely. And what excites you on a personal level to be involved in healthcare?
Healthcare, you're making a difference to people's lives. So that's kind of my own purpose that I connect with. And I think it's really valuable when you're looking through patient data, whereas if people are waiting, how long they're waiting to see in an A&E environment, or, how long they're waiting for their treatment or their surgery, and how you can utilize your talent to really show something that might be buried under the data and looking it through. Because sometimes when you see people, our clinicians, our consultants, they're firefighting day to day.
Yeah.
And they're doing a fantastic job. But sometimes data can reveal which cohort of people you might need to see first to really enable their well-being and their life. So that really matters to me. So when I joined the health service as a whole, that you're making difference to people walking in to have their healthcare. And we go to surgeries ourselves, so that we can all relate to it.
Yeah, 100%. And then specifically at the British Heart Foundation then, to do with cardiovascular.
Yeah.
And I know when we spoke offline, you mentioned about defibrillators and the data behind that. So could you just give an example of the initiatives there as well?
Yeah, I mean, the cardiovascular health remains a major threat to the population, really, in the UK and globally. So there's been some studies, I'll give you, because it's a data show, some facts.
Yes, we like data. We like data.
So by even 2030, cardiovascular disease remains top 3 disease areas. So there are currently 7.6 million people living with cardiovascular disease, with heart and circulatory disease in this country.
Right.
And around half of us will get cardiovascular disease in our lifetime. So that remains a big threat. So British Heart Foundation, my role in the medical directorate, really to understand what the data is telling us. And also British Heart Foundation funds a lot of research to really come up with innovative ways of how we can tackle cardiovascular problem and help people's well-being. So Circuit is one of the byproduct. There's lots of funding that gets pushed into how to help people who are suffering from heart and circulatory disease. So we call it Circuit. You can look online. So Circuit is the defibrillator database. So you can type in your postcode and it will show you where you've got your closest defibrillator.
Oh, brilliant.
And British Heart Foundation working with the ambulance service in the UK, that's Scotland, Wales, Northern Ireland as well. So, and really servicing and working with the ambulance trusts to understand where they can put the defibrillator, and when somebody uses that defibrillator, how they can get quickly access to an ambulance service so more lives can be saved.
Yes.
Because we're seeing more and more people are having cardiac arrests.
Yeah, and there is a lack of understanding and knowledge, isn't there, as where they are. And I don't know who is responsible for that. Is it the government? Is it local council? Is it schools? Is it workforces? And I imagine the British Heart Foundation, do you work with all those organisations I just mentioned?
Yeah, it's a complex picture because, the defibrillator itself is just devices. So obviously they have to be funded. And sometimes because this is what the charities, sometimes, Cancer Research UK and British Heart Foundation play a vital role in the society and communities, because we're doing some groundwork. So my team's doing some groundwork to understand where the defibrillator will be best served. So looking at the community, looking at, their population, their age, and where we can fit them. So we've now got a community defibrillator program at BHF. So if anybody listening to this and they don't see any defibrillator in their area, they can get in touch with British Heart Foundation and they will be provided with a fully funded defibrillator in their area.
Fantastic.
So a lot of people have got those things. And also when you go to the Circuit website, then you will find where its nearest defibrillator is.
Yeah.
Part of that is how you mentioned about the schools, education, people's awareness. So we've developed an app called Reviver.
Okay.
So before, you needed mannequin to do resuscitation training.
Yeah.
So it only takes 15 minutes. So you can download the app on your phone. It's called Reviver, and you just use a pillow or a cushion to just try it out, because people confidence sometimes is not there, because if you see someone having a cardiac arrest, what do you do? So we're trying to really raise the awareness, because it's not difficult actually to do, but it could save someone's life.
Yeah, I've been to first aid training myself, and the number one thing I remembered is if you see someone having a cardiac arrest, everyone assumes that someone else has called the ambulance.
Yeah.
So you really need to be authoritative and say, you call the ambulance, call 999, you do this, you do that, because otherwise it's a proverbial we, like, oh, someone must have done it, and it's the wrong assumptions. But again, it's like we should be, it's such a basic thing, isn't it? And it's amazing you've got this app. So what's the app called again?
It's Reviver, so
Reviver.
Revivr.
Yes.
So you can search for it on Google, you can find it and you just download it. Actually, I sometimes download download it and then refresh the
Yes.
training myself, because you forget.
Yeah, you do.
And sometimes you think, oh, if it happens, am I prepared?
Yeah.
So the app just gets you prepared into if you needed to tackle those situations.
Yeah.
But you're right. I mean, if it happens, it's quite an extreme situation. So people feel vulnerable,
Yes.
what they need to do,
Yeah.
and who need to call 999.
Yeah.
But it's also very important to ring 999, because the
Of course.
ambulance could literally save someone's life. So although you are just delaying the process, you need
Yeah.
an ambulance to be there to
Yeah.
really take the person to hospital. And
Yeah. And then are you tracking those cases as well to understand what brought it on, the age group, demographic? Is all that data being tracked?
Some of it,
Yeah.
not all of it. It's because the data is nowadays still sits in different silos. And that's part of the health service, the overall delivery.
Yeah.
You know, like if you think about maybe a retail shop, Sainsbury's or Tesco, or Google even, they're probably tracking us all the time, and they get our full life history of what's going on. So I think health service have got a long way to go to that.
Yeah.
But we have data in several places. So we're trying to track why somebody's having a cardiac arrest and, what happens after. If you used a defibrillator, we don't have that data now, because when an ambulance service come in, they obviously record that defibrillator was used.
Yeah.
But we can't at the moment link what happened, the outcome of that person going into hospital, whether they survived or, they developed some other conditions or something else. But we're
Right.
trying that
Yeah.
to develop an overall picture about a person's life.
Yeah.
As a whole.
Yeah, we need that. You're right.
Yeah.
So is that an overall aim, do you think, or something you'd like to see in healthcare? Because there are the different silos and it have a more centralised model.
Yeah, I think, like I mentioned, with the machine learning and new advanced ways of analytics are coming in, you do need to understand multiple conditions of someone goes through. So it's not just one area. So for example, you may have cardiovascular disease, but you may also have an underlying mental health issue that you've been suffering from a long time. So the type of delivery of the health service needs to be provided to that person in a personal way. It should be different. So I think we need to join all of those together.
Yes.
They largely exist. It's a
Yeah.
way of how pulling it together. I can tell you that it's much better than what it was
Yeah.
probably 10 years ago.
Yeah, of
but it's
course.
still a journey to get to that, to
Yeah.
really look at, because clinically people have different pathways. So if you have cancer, you go on cancer pathway. If you're on a cardiovascular journey, then you go on a heart disease pathway. But actually it's people life pathway that I call it. So the data becomes part of your life journey. So we need to map that in that way rather than disease areas.
Yeah.
And I think that will really provide an overarching view of how someone's leading their life and and you can perhaps predict better on what's
Yeah.
likely to come.
You are right as well. And then when you do have these appointments, you don't have to give them your life story again.
No.
The data's already there.
Yeah.
And coming into it, if someone has mental health issues or anxiety or whatever, you know that maybe they need a bit more empathy, compassion, explaining.
Yeah.
So is this are these clear messages and clear goals within healthcare, would you say?
Yeah, so I'll tell you a little bit about my other side of the role I do voluntarily.
Sure.
So I'm a CEO of an organization called AphA. So AphA is the Association of Professional Healthcare Analysts. So anybody working in health and care as a data engineer, data analyst, data scientist, they are a member of this organization. When we have 14 branches all over the UK and quite a lot of members organizations. So all of the NHS trusts, the ICB, the Integrated Care Board, so all different various layers, they are members of this. So what we're trying to do is really educate, because you need to really build the workforce in a certain way so they recognize they're professional, they're able to take that journey themselves. And also create specialist groups of analysts who understands the data, who has the health service experience, but able to bring their talent in to really look at how they could utilize those talents to create these kind of bigger data sets and bring it together. So that's what we're really trying to achieve.
Brilliant. And is this in healthcare, or are these all different backgrounds that exist?
No, so this organization, AphA, is really for healthcare analysts. So you have to work in health.
Yeah.
We thought about it multiple times, that because the analysis as a practice, as a profession, probably you can apply it anywhere.
Yeah.
But we really wanted to bring in that experience you have through health lens, because there's lots and lots of stuff going on.
Yeah.
We're serving a whole population of the UK, and there are lots of different multifactorial things that are coming coming into play
Yeah.
when you're providing care.
Very
So we
unique.
wanted to focus on the people who are working in health and really supporting them, their journey. So how do they come in as a junior analyst, but how are they supported? So an example of that is when I started, when you asked me about the question, how did I feel at that time when I started? So I didn't really have any competency framework, any career pathway or guidance, how that happened. So about 3 years ago, we started our journey from AphA to create and pull together an analytics framework. So if you start as a junior analyst, how do you develop your career?
Brilliant.
To look towards like the chief data and analytics officer, that sorts of role. So we now have that. We have a national competency framework. There are lots of people are using it now.
Brilliant.
So that not only provides just the support for someone to really understand how they can develop their career, but also those fundamentals about how do we make a difference in health are embedded within those frameworks.
Okay.
So it's not just a profession. It's about really our core purpose of supporting people and making people live a better life.
Yeah, makes sense. And then can people gain accreditations and qualifications through this process?
Yeah, so we have a registration process. This is really interesting topic actually, because if you look at a finance professional or a human resources professional, you will see and clinicians, of course, you wouldn't go and see a GP who's been taken off from their register, for example. So analysts never really had registration for them to prove that they are doing. So anybody essentially coming into this profession could call themselves an analyst. But how do we know that they are providing? Because we know data can save lives, right?
Yeah.
But data could also kill lives in that same way if you misuse the data in a different way. So how do you ensure that the quality of the data and the work that you're doing really bring in that value? So we have 5 different levels of registration. So you can be an associate practitioner to a leading practitioner. So I've gone through that journey and I'm a leading practitioner. But it's really understanding and telling people that what you are talking about makes sense and the subject area.
Yeah, no, I think it's a brilliant idea and initiative because it is key, and also it's fairly new in terms of a career. I mean, it's a lot better than it was maybe when you started your journey, but still it's educating people on it is a good career choice. But through that, here's a framework rather than, and each sector has a different way, but in health, like you said, it's so unique. It's important that people can follow that framework. And is this for private and public health organisations as well?
Yeah, anybody working in health.
Yeah,
so
brilliant.
if you're working in a private industry, but you're servicing the health sector, for example, then you can go through that. And I think, Emma, there's something more important to me is actually the workforce about encouraging, inspiring people who are coming into the profession.
Of course,
because sometimes it's really difficult for people coming out of schools, coming out of college, whether they could choose analytics as a profession, but sometimes they might be interested in health, but they have no idea how to get into health or, what does health is different than any other industry. So we're trying to make a good case for someone who wanting to do this profession, really understand how health data could impact someone's life and how they can play their part. So it's easier for somebody coming out of his school, so college, thinking about, I want to take an analytics journey, but I would like the journey to be in health. How do I do that? So that now that's more available than it was before. And also, I think other routes as well, apprenticeship, because people sometimes traditionally just go with universities. Whilst they're not bad at all, they're very good markers, but people may choose other routes. People come from apprenticeship routes, and we are seeing more and more people getting interested in health coming from those. Previously, probably 2 or 3 years ago, I would say they would have probably gone on to different industries because of lack of knowledge. And we need more workforce to be in health to really make a difference to what we're seeing now.
No, apprenticeships are brilliant, and upskilling people as well that may already be in healthcare but not in analytics who want a career change, because for social mobility it's so important to make these programs accessible, because university isn't an option for everyone. Especially as it's getting more and more expensive. But that way of learning doesn't suit everyone as well, so apprenticeships are brilliant. And upskilling people that are already in already have a passion for healthcare, just maybe not in data. And you're clearly very passionate about it as well. So how does it work then? So say, for example, I want to, get involved. What steps do I need to take to be accredited and get on the framework?
Sure. So you have to be a member of AphA. So AphA is the Association of Professional Healthcare Analysts. You can search online. So you can be a member of AphA, which costs an average about £42 per person. So it's not a great deal of money for someone who are wanting to take the career in there. What we suggest, if it's not an individual, if anybody's listening and they're working in an organization, to have a group membership that provides a better access to all the offering. And then once you become a member, then similar to nursing profession or anything else, you register to be an accredited professional. For that, you have to provide 3 reflective practice, we call it. Essentially, they're your experience. So you're showing what you've done, and they were of quality and they made a difference. So that goes through an external process of accreditation, and then you get external validation. So we sit under an organization called FedIP. So FedIP is Federation of Informatics Professionals. So they have British Computer Society, AphA, and other professional bodies of people who are working in digital field, digital data and technology. So they provide the external accreditation. So it's not just us saying that we think someone's good enough. It's also get externally verified. So that also gives someone a real sense of recognition that they could take to the organization or talk to other people. Because that's one of the real difficulty when you work in data. Even when I go back and talk to my families, they still now
glaze saver.
Yeah, what do you do?
Sorry, Rony, what is it you do all day? Yeah, and that's the thing. And I just said before, actually, you know, the podcast, we're here to empower people who do understand, because data is ubiquitous, and we should all be making better informed decisions in our lives as well. Absolutely. So interestingly, what inspired you to get into healthcare in the beginning?
So I really, I come from a kind of medically driven family. So my dad worked for World Health Organization. My older brother, he's a doctor. So I wanted to get in, but my passion was in technology.
Yes.
So my education was in computer science. So I worked for a long period of time in mainframe IT. So I developed servers, I developed SharePoints, all of those kind of things. And then I realized that actually it's not really giving me the sense of purpose that I look for. So one of the things I would say to people who are starting their career journey, they need to really ask themselves, what is their purpose? What keeps them awake at night, or what gets them to wake up in the morning?
Yeah.
So for me, it was about, utilizing what I know to make a difference in the people's lives. And I found quite a good segue of doing that by coming into the health sector. So NHS role came up as an analyst. I started my role and then end up leading lots of data analytics team for several years, and it's been highlight of my career really. So that's really got me into health data, because you're really seeing the work you're doing is making a difference. So if you're working for, let's say, an acute trust, a hospital trust, and your data is getting seen by the consultant, they're seeing people on a day-to-day basis. So you can see the real impact of your works happening on a day-to-day basis, which really mattered to me, which might matter to other people too. So
that positive impact. And the NHS, what was that like to working? Because it's absolutely huge, and many people have different experiences. But how was your experience?
It was a mixed experience to begin with, because as you say, that when you come into an organization at such a scale, then sometimes you feel a bit overwhelmed.
Yeah, I can imagine.
And still people feel overwhelmed, but that's okay. I think sometimes in an organization you feel overwhelmed. But I think the opportunity was massive. I could see that their potential to make a difference with data was there from when I started, even though the technology wasn't to a lot of things that it is now. But the opportunity for how you utilize data in a way that you could help people's life was there. So it is a big organization. I think more and more people are trying to connect together.
Yes.
I talked about AphA. We're bringing people together where you do one thing in one place, and how do you share that with others?
Of course, share the knowledge.
So you're not replicating the same thing, because you end up doing that lots of time. And how do we really share the knowledge, or even make it better by working together? So if you have something, there's no shame of sharing your code, for example, with somebody else who's in the field of within data. And let's have a conversation together. So we're trying to enable those conversations. Also, I'm really keen about how do we support mentors, because when I started, part of the problem was that health service in non-clinical role, like the data, didn't have any mentorship program.
Right.
So, in a clinical role or other roles, you would have a mentor, which I think really helps. I mean, even people listening to this, they are kind of getting a mentoring opportunity to learn how people move through their career. So I think it's really important to have that. So we've now enabled mentorship program through AphA. So lots of people who are maybe on senior roles wanting to be a director role, or junior analysts wanting to be a data scientist. We're pairing people up with people who have done it already, so they can give real life advice on how they could take their career in the way they want.
It's so key, isn't it? We're starting that through our She Does Data non-for-profit community, and it's also like allowing people to understand what's possible, asking questions that they might be afraid to ask to a larger audience, and just understanding their unique journey, and having a role model in the space as well is important, isn't it? So how long was it until you became a leader in the space, and did you always want to take that leadership journey?
So I've been leader for about, I think 14 years. So I've led data and analytics team for about 14 years in various different organizations. So when I started as a senior analyst, I moved my post to become a more senior person. And then I realized that for me to really able to gather the expertise within the team, there was something in me that I could offer in terms of leading the team and really make a difference. And it just happened to be, I obviously pursued my role in a leadership role. Well, it's enabled me now to really understand the health data industry and how it works together, and how we could really make a difference by working together and add some more value. Because sometimes it's so easy to just carry on doing what you're doing, because that's a safe place to do. But actually doing something different, enabling newer ways of working, exploring that how we could work together by not replicating something, and actually enabling, I would say, some expert groups. So one of the things I'm really keen about is to establish a Women in Health data network. So we actually see, fortunately, more and more women in data rather than more and more women going into technology teams. But I think we need to do more.
We do.
And even though the women, they individually wants to become involved in data, they don't have a network of support group, if you like. So I'm really keen. And we're launching a Women in Health data network in September alongside an apprenticeship provider actually called Cambridge Spark.
Brilliant.
So we're going to try and inspire women who are coming into analytics and interested in health data, and bring them into how they could take part in the health journey.
Great, because we need more allies like you in the space, because that's something I'm passionate about, driving change in as well. And when you talk about these things, some men are like, well, what about us? And we're like, you're missing the point. Of course we want opportunity for everyone, it to be equal, but there is a real disparity, and it's not the same in every country. I've heard that in Spain it's a lot more 50-50 split.
Wow, that's really interesting.
So this is where there's education that can change things, association with certain professions from a young age. I don't know if you've heard of the research thing, draw a scientist.
No.
But if you ask a 4-year-old to draw a scientist, it's quite a 50-50 split. But then as they go through education and become teenagers, 80% say we'll draw a male, not a female. So what are our books? Even it's just something as simple as in your textbook, all the scientists, all the doctors, whatever, are male. And, that then registers with young children, right, okay, I don't have any role models. I don't know anyone that's... So, it's that accessibility, isn't it? So in terms of leadership then, how would you describe your leadership style, and has that evolved over the past few years? How I would, you probably have to ask the colleagues that I manage. They probably tell you a different story. No, I hope not. My leadership style really begins with people. And I've always been led by this. That doesn't matter which field you work in, technology, whatever else. It actually is the people who matters. And I've always really worked with this principle about looking after people, supporting their development, because a lot of people actually, as leaders, says these right things, but actually don't do these things. And it doesn't take a lot to really put things in place. So I've always tried to support people and really led by what I can deliver. And when I can't do something, really being transparent with people that this is out of my control. And sometimes having the transparent discussion with your team. That's key.
People in traditional ways sometimes keep themselves back from having transparent conversation. I think it's really important. I think we all in industries, because we have a purpose that we're connected with, whether that's health, whether that's something else, but it all begins with people, and they all want to do the same thing together. So it makes a massive difference if you are open up to people, if you really show that you're making a difference by supporting your people about their professional development, and on a personal level as well, about allowing people some flexibility. And And for me, obviously, another thing really important for me is diversity.
Yeah.
I come from an ethnic minority background, and like you said, when people are drawing things, people need to look up to people to understand that he sounds like me or he looks like me. It is possible. There's so many people. I've just been to a conference, actually, an analytics national conference, and so many people walked up to me and asked me, how do you feel about where you are, and how difficult was it? I mean, it was very difficult, but it's really necessary for people to step up and do these roles, because they need to show that it is possible. More women need to be in leadership position. They need to show that it is possible, so other women can also look up to it.
Yeah, absolutely. The power of see, believe, be. And also, again, it's not a criticism like, for example, all white male board, but there is subconscious bias there, and we're not saying they're bad people, but they haven't been in certain situations, so can't relate to that background. We don't want, and this is the criticism with government, without getting political, but traditionally come from the same university, the same schooling, and it's like fantastic, but you've all got a similar train of thought, and that's why diverse perspective is so important. But no, I think that's brilliant, the human-centric leadership approach. And did you have a role model, interestingly, on your journey?
Yeah, I mean, it's really interesting, isn't it? Because you go through your personal and professional journeys, and you find some really, really good leaders, really good managers. You have some bad experience. So I had both. I had some fantastic people who really supported me through my career. I also had the other side of things where I've seen what not to do.
Yes,
I think that definitely helped me too.
Yeah.
And I think a lot of the time when I'm having a conversation with a colleague around, where their future prospect is becoming a leader, I always say to them that they need to really think about the mindset of people. So if you want to be a leader, you really have to think about what your mindset is and what is the value that's driving you to go to that leadership position. And that really changed the perspective of how you operate with people. You talked about human-centric. If your ultimate drive is not people and you're seeking a leadership position, I think that fundamentally creates a lot of problem down the line.
It does, yeah. There can be friction there. But then again, against that, some people are kind of pushed into leadership roles, aren't they? Because that's the only path available for them. So if they don't want to manage people, well, there's no promotion available. So really we need more technical paths available for people, and leadership as well. But the incentive has to be for the right reason. Because they want to make a positive impact on people.
But I absolutely agree with you, though. I think you hit a really good point, actually. There are lots of really, really talented people who, even on the health service system, I'm sure that system will be across other industries too, that if you want to be more senior, you have to pick up line management, and you have to do these things, because that becomes an extension of your job role, and then that warrants you to progress. But there are, for example, some data scientists who are really, really good, but they are not good leaders at all. And that's not a good or a bad thing. It's they just excels into something they really do. So I think we need more specialized senior level technical post. In analytics, definitely, I think we see more in technology. I think we need to see more AI specialist role. I would say more data evangelist posts. So I would really look for that, really talking about what insights can make a difference in organizations. People sometimes don't understand what it can bring, because you could develop a fantastic model, and I've seen it time and time again, which will deliver really good health outcomes, but because people don't understand it, because it's not really translating in a language people understand, it doesn't end up being used, and that's also not very good. So you need someone to bridge the gap between people talking their language, but also really promoting the work and value that it can add.
Yeah. At the same time, the tech has innovated. We need leadership to innovate as well. It's such a good point, because you used the term before, have to. Well, as soon as someone's like, oh, I have to manage people, that negative connotation, but there's different roles available, and I think leaders as well, you don't necessarily have to physically manage people, but a leader is a role model. So maybe that's someone you look up to that isn't managing someone, but I want to be that person in the organization, because they inspire at some level. I know we've touched on it briefly, but I'd love to go into more depth, AI and data science, and how that can save lives ultimately.
Yeah, I think more and more of these technology advancements are coming in. I think is a real advantage of our capability. Probably all the options that you have available.
Yeah.
Not only the time that it takes to do these things, but also to really understand. So an example of that I will give. Let's say helpline. So British Heart Foundation, we have a helpline, but NHS have helplines where people ring. They talk to people, they triage people. To be able to analyze with a large language model what people are asking for, it's really difficult because what usually happens, and it happens even now, that you have a phone call with someone and then you type it in a form. And then analysts like us or other people, then they analyze that data.
Right.
But it's missing from someone who's telling you what the problem is. So I think with the advancement of AI, when you're ringing someone, you're explaining the problem yourself. So that enabling us to really understand from the raw source of what the problem is or where people are asking for help and really put that to the forefront. So utilizing a lot more data than we've been able to in a much more faster way with the health service knowledge that people have within the industry can make a real difference. The other example is how do you predict? So, when you're coming into a care to see a GP, for example, they are seeing maybe one condition. I talked about multiple conditions people have. And which one do they need to prioritize? What medication do they need to prescribe? Is there some decision support tool with analytics that people can do that will show something, will ultimately makes clinicians' life a lot easier because what they're doing is they're doing a peer review of the system. And so it cuts down the time of their concentrating on a computer monitor than the people they're seeing. I mean, you probably experienced lots of times that GPs, not by their own fault, is spending more time typing in the data when you're talking rather than talking to you.
Yeah. So do you think there could be voice recognition then with that? So say I go to an appointment, if I'm comfortable and I'm told beforehand, your voice, everything you say will be transcribed.
Yeah.
And then there is that more, because, I've been to those appointments and some doctors, you really feel it when they feel like they care, they're listening to you, and others are just like, oh, what did you say? Yeah. And it's not their fault, like you said. But you should take those administrative tasks away.
Yeah.
And then you're probably more likely to open up. When you feel like, you may think, I won't tell them that because it's not important. But if you're having a better conversation, there may be issues that you think are maybe not important, but you raise them because you feel comfortable in the environment you're in.
Absolutely right. Because, the first 2 or 3 minutes, even 5 minutes, you're not likely to really go down to the depth of the problem if you're seeing someone. Because, for one, you probably don't feel very comfortable at saying everything as soon as you go into a room. But I think, like you said, voice recognition. If you ask someone, I think 9 out of 10 times people would say yes.
Yeah.
That's another misconception, because there's lots and lots of data available in the health service. People always assume within the health service that people are not happy about sharing their data. Anybody I speak to, and even, from my own personal network, anybody would be happy to share their network if it makes a difference to somebody else. As long as you're not being identifiable, then it really doesn't matter if people don't know, who I am or my address, where that is. My condition, if that helps somebody else, I'd be happy to share that data. Because that helps research as well. Because British Heart Foundation, we spend about £126 million every year on cardiovascular research. And that's people's money they're donating to British Heart Foundation through our stores, through our fundraising channels. But that money gets invested and it just gives you a sense of 126 million to 146 million pound invested every year. We'll find a cure for some of those really life-threatening diseases, but it just needs to carry on. But it does need to use the people's data. If you don't have that, then actually none of the research could take place because they're based on people's health.
I think we have a real negative connotation with sharing data, don't we? Because we think, who are you going to sell it to? This, but it's actually just making people aware. By sharing this data, you'll not only increase the chances of saving your life, but other people's lives. And I think if you make it that simple to people, they're like, oh yeah, why would I not want to do that?
Yeah.
So for research purposes as well. So are you excited about the future of AI and data science then, and more advancements as well?
I'm really excited about this. And just going back to your point, what you mentioned, Emma, I think it is really important. I think health service probably don't do that very well now to let people know, because there is a miscommunication, I think, or misunderstanding in people's mind that actually my data is being sold at lots of other companies or pharmaceutical industry. So I don't want to do that. But the more and more we can be open, the better access we will have. But yeah, I'm really excited because some technology is coming all the time. I was having a conversation with one colleague last week about a 4D TV. I'm sure you remember, or 3D TV. They come in, and I even had one bought, and they don't last because it's gone. You can't really buy 3D TVs anymore. No. You either went to the cinema to look at a 3D cinema or something, but you didn't need that at home. So lots of innovation coming, but they don't only stay. But I think AI and machine learning, all of this are here to stay. And that's obvious, our lives will be transformed with the technological change. But how do we take advantage of that, bring in the front foot of what we could utilize in data? I think it's very exciting prospect.
Yeah, very exciting. So before we move on to the quick fire round, I just want to go back to something that you mentioned before and your own personal journey, if we may, because, as you know, I'm very passionate about diversity and surely women in leadership positions, but definitely those from ethnic minority groups as well. So could you just elaborate a little bit more, because you said there were challenges that you faced on your journey?
I think it's been quite challenging sometimes to move through my own career, because people, I think, that they have biases built into their system. And I think there's more and more diverse way of people thinks, the more strength it brings. Because I think, you were talking about this, and one group of people, even that is one group of ethnic minority people, is not really good. You need a mixture of lots of diverse train of thoughts, and that really strengthened the whatever you're doing, essentially. So I, you talked about my own personal experience. I faced lots of challenges through my career. So I think I had to fight extra hard to get to where I am now. Probably would have been easier if I was in a different color or something else. So I feel it because I had to go through that journey. But what I would say that it's not impossible. And sometimes it stops people because they think that they have to put that little bit more work. I mean, that's probably not the right way of doing it. But even so, they need to lead by examples and allow others to see that it is possible to do. So the more and more we welcome people from those backgrounds, from all different backgrounds actually, the more we will enable people to think it through. And if we can really target that from the very beginning funnels of when people is starting their journey, I think that's the way to really enable people to grow in their career. But I've also had, throughout everybody's journey, you also have some fantastic people who support you throughout my journey. So I've had some really great friends and colleagues who supported me through my career. And I think that positive support network is really, really important, because there's lots of things gets you down on a day-to-day. But you can always resort to that group of people or that person that gives you that sense of positivity. I think that's really important for all of us. And that's really kept me alive through my game.
Absolutely.
Essentially coming through.
I mean, you strike me as a very positive person, but I imagine at times you've had to dig deep to find that inner resilience. And is it something you talk to your parents about? Because I know you moved over when you were 11 years old, is it? So they probably came up against similar, if not worse, hardship. So did they give you lessons in how to navigate those situations as well?
I think it's difficult. I mean, we talk about these things and people give you general advice, but actually the personal experiences you have probably will be slightly different from every individual. So it's quite difficult. But if you have a support network, which I had, fortunately I had in this country, so I moved over when I was 14. But so that network kind of gives you, because although it's different, in some ways that the themes of what people experience are the same, and unfortunately people, experience those things even now. But what really made my thinking a huge difference is that I went to a top leaders program with King's Fund. So that was about 6 weeks. And it's completely different than any other training that I've ever done in my life. So it's a different training that you don't get, taught with slides or anything else. But you have so there was a group of 42 people, And we really openly discussed, and that was very diverse group from all background and ethnicity. What does this mean about being a different color or being a different gender or have a disability? So we talked about that probably for 4 weeks out of 6 weeks of our program.
Yeah.
Because people keep these to themselves and they don't talk about it. I'm probably also the victim of that. Sometimes don't open up too much. I think that keeps people, keeps their thoughts within them. The more and more we can open up and more safe environment we can create for people to share their experiences, I think the better it will help them to grow in their personal and professional career.
Absolutely, yeah. So what was this leadership program called?
It's Top Leaders Program by King's Fund.
Brilliant, okay.
Yeah.
And did you apply to that then?
Yeah, I did. So you have to go through a selection process, but I was very privileged to do that, actually. I would recommend it to anyone. If you're listening and if you want to go in any courses, that would probably be my first course that I would recommend.
Yeah, 100%. We do need, and it's the awareness, and also not, I think people are afraid to get it wrong and say the wrong thing and approach things in certain manners. Or then there's people who are like, well, I don't have any biases. It's like, we all have them.
Yeah.
You know, I'll have them against females just because, society tells us that females aren't good at X, Y, and Z.
No, sure.
Naturally we have those, and it's bizarre. But no, the awareness, it definitely starts with awareness.
Yes, I absolutely agree. I have biases too. But how do you overcome those? And really play it out sometimes to really hear from the other person and then understand that actually it is okay to talk about these things.
Yeah, cool.
And there's something I really liked you said that, we could get things wrong. So going back to the leadership question as well, you asked for my leadership style. I think I open up more so than I did before in my early parts of my career. I get things wrong, but that's okay. I tell my team that I got this thing wrong. A lot of people are very afraid of admitting
they are
wrong, but I say it openly. But I actually encourage my team to open up and say, it's not about getting it wrong or failing something. It's about learning from that experience, really.
100%.
So as long as we can turn that coin into the other side, I think people are more open. They can create that culture about sharing.
They can for sure. Okay, we're going to move on to the data lightning quick fire round. What is one common misconception about data that you'd like to debunk?
Misconception that there is always data quality issues. So if you're trying to do something and it's taken a long time or something else or people don't trust it, people always will talk about, there's a data quality issue.
Yeah.
But I think that's like one thing that will always exist.
Right.
You will never get rid of data quality issues.
Yeah.
So I think that as long as you can produce something which is of some quality that you can consider. I mean, this is like the thing people always try to say, there's a huge data quality issues. I can't do that.
Yeah. So even if it's not 100% accurate, just present something. Okay.
Yeah.
Name a book, podcast, or event that every data enthusiast should explore.
Oh, that's a good question. I would say Atul Gawande. I don't know if you heard his name before. He writes some really good health-related books. He's been involved in US and other countries in health industries. So one book I remember is still called The Checklist Manifesto. So he talks about, on pilots on the aeroplane. So they're obviously very, very well trained.
Yes.
But every time they fly, they have to go through a checklist. Because it doesn't matter how senior you are, your co-pilot talks you through this checklist and you still have to say yes or no, just to make sure that you're doing things the right order, because people forget.
Yeah, of course.
And Health learned a lot from his book because if you are a surgeon, if you are a consultant surgeon, then you think that you've learned it all. And, you don't need to hear from nurses in the operating theatre. I know more. But actually, Health Service found that more and more people are doing this kind of checks, have saved more lives because people tend to forget because we're human.
Yeah. And we think, I don't need to know the basics. It's like driving.
Yeah.
You've driven for so long, you'll probably forget the basics, because I drive an automatic. I had to drive a manual the other day. I was like, oh my God, I feel like I'm coasting along. So that's so important. That's
but also
brilliant.
really, really closely linked to data. So I would say to you that if you are reviewing someone, doing a peer review of someone's code, peer review of a big project, peer review for modeling or predictive analysis, you have to have a checklist that you can go through, because sometimes you do forget prompts.
Yeah, such a good point. Okay, finish this sentence. Data is the key to.
saving lives.
Love that. What is one piece of advice that you'd give to someone just starting their career in data?
I'll go back to what I talked to you before. So I think people sometimes take a long time to find their purpose, what's really interesting them, and what's their own purpose is. As long as you can connect with your purpose, I think you will connect more with what you can deliver with the data you're working with.
Yes.
So I think that's hugely important, whether you're working in health or any other industries. I think it's really important to really find and spend some time yourselves to think through what your purpose is, what keeps you going.
Yeah, and that's brilliant advice in or out of data, is it?
Yeah.
Isn't it? Just
No,
to think,
exactly.
why am I here? What is my purpose? And number 5, looking to the future, what do you think will be the greatest development in data?
I would actually say that it would be the leadership of data. So we've just launched a Chief Analytical Officers Network. So it didn't exist in the health sector. So you had Chief Information Officers. But data is an own entity. So it's very embryonic now. So it's only been a few months. And we've seen massive amount of people who are leading teams still not finding what is the next step or where their peer group is and how do they support their teams. So I think data leadership will be key, not only to develop the people who are coming into the profession, but also for the rest of the organization, people who are non-data people,
Yes.
I call it in a simple way.
Yeah.
That how do they understand the benefit and how do we work as partners? Only by working in partnership, I think, and bringing that leadership will unlock the key to a lot more potential of the data that we use.
So true. Well, thank you. That's
No
it.
problem.
You can
Thank
breathe
very
now.
much. Thank you.